You're an old hat at this already. I mean, you had such an impassioned, that was on Monday, that was pretty incredible how impassioned you were. Did you practice that speech?
No, I'm upset. I'm upset. This is not, I'm not acting up, I'm not putting this up. People are dying. Do you understand? People are dying. Like, we just had news that Herman Cain died. He didn't have to die. People are like, well, he should have worn a mask. Yes, he should have. If he didn't have hydroxychloroquine on board, he should have worn a mask. If
You're saying Herman Cain, who died, who just died, he didn't need to, he could have had
if somebody treated him early with hydroxychloroquine, it's most likely he would not have died.
Really?
Just like every other every other person that has died from coronavirus did not have to die.
But you understand that the World Health Organization, the FDA, they don't agree with you.
Of course they don't agree with me.
They think you're dangerous.
Of course they think I'm dangerous because I'm speaking truth. I've said it many times. Number one, ask Dr. Anthony Fauci, when is the last time you saw a patient? When is the last time he put a stethoscope on a patient's thing? And I'm willing to ask him that. Number two, I'm still waiting for him to come and give me a pee sample to find out whether he's not on hydroxychloroquine himself. The studies that we did on hydroxychloroquine were done under Dr. Anthony Fauci. This is craziness. I have treated right now in our clinic over 400 patients. This is Houston. My patients are going to speak up. You're going to talk to them. You can put something on the news and call and tell people that have been treated to call. We've treated diabetic patients. We've treated pregnant women. We've treated old people, 87-year-olds. People, this is craziness. I don't know what they are doing, and somebody needs to tell me, FDA, Anthony Fauci, WHO, why do you want people to die?
They think it has side effects, that it's dangerous, and the efficacy. There was just that thing in the New England Journal of Medicine that came out and says, hey, it didn't work.
Okay.
There's yet another study that says this doesn't work.
There are many studies that say it works. There are many studies all over the world that say it works. People, I just had something on Facebook today or somebody, Dr. Stella, we badly want to see your data. I was like, no, you don't. You don't want to see my data.
Why not?
There are over 100 papers that have been published all over the world. In India, in Turkey, in France. Each time these papers come out that this thing works, they do a smear campaign because if they know that, let me tell you something. Do you know how much hydroxychloroquine costs? $20. By the time you get hydroxychloroquine, zinc, vitamin C, and Z-Pack, tops maybe $50, $60. You have a whole treatment for COVID.
You call it more than treatment. You called it a cure.
It is a cure. What's a cure?
A cure means it's eradicated, essentially.
Yes, it eradicates the symptoms. It eradicates the virus. We see patients day 1, we put them on hydroxychloroquine, they come back day 7, day 10, and they're negative. It eradicates the virus. It is a cure. I don't know why people are getting crazy about this.
Well, that's a minority view on whether or not it's a cure, that's for sure.
Let me tell you something. When you have some 300, 400 patients, and none of them has died, it is not a minority view. The people that I say this all the time. The doctors that are saying this thing don't work, most of them, they don't see patients. Dermatologists, and I'm not knocking their specialties. They don't see patients. And they're like, well, she's a pediatrician. I'm a pediatrician and I work in the emergency room. I've done that for years. When I trained in Africa, we train as general practitioners. We don't train as pediatricians or orthopedics or whatever. We train like general practitioners. When I came here, I did a residency in pediatrics because that's the residency I got into. But once I finished residency, I've been able to work in pediatrics and work in the emergency room, seeing adults, intubating people. I've done that for years. So I'm basically a general physician.
Why not just, though, to sort of silence your critics, publish your data?
And what would I do? I have the data. I'm going to publish it, but what would I do? How about Dr. Rao's data? Dr. Rao, a renowned virologist, published a data for over 4,000 patients. They vilified him. Although I just got some listen that France is now agreeing for patients to see this, for people to use hydroxychloroquine. Recently, there's a doctor in Yale that published data. I
saw that. It was a news
So
week.
there's enough data. The minute one of those comes down, then they gather a few doctors.
Then what is it?
And pay them money.
Why is everybody not on board with you then?
They cannot be on board with me because of big pharma. I can tell you exactly what's going on. There are different layers here. There are people that are just opportunistic. They figured out if this virus drives people crazy and everybody is afraid and schools are locked down, somebody will lose the election, somebody will win the election. That's stupid. Because the virus doesn't care whether you're Republican or Democrat. Those are the opportunistic people. Then there are people that don't have no clue. Doctors that are scared of this medication because they hear this narrative. They've never taken hydroxychloroquine. They don't know it. I keep saying rheumatologists, speak up. You put patients on this, 15 years, they are taking twice a day for 15 years, and nothing happens. Speak up. They've never taken patients off hydroxychloroquine because they have some cardiac issue. Speak up. Do you understand what I'm saying? They know that. I'm comfortable with this medication because I took Nivaquine, Flavoquine, Camoquine. We took it growing up.
You're taking it right now, aren't you?
Yes, I take 2 pills twice a month. And I see, you saw our clinic. Can we social distance in this clinic? We can't. Do you understand? So I work with surgical masks. This is my mask that I work with. I wear this mask so that my patients can be comfortable.
You don't buy the whole mask thing.
Listen, no. If you're not on prophylaxis, wear a mask. Do you understand what I'm saying? I'm not one of those. I'm not anti-mask. I'm not anti-vaxxer. I'm not anti all of those things. I'm just saying that all this vaccine, mask, and everything, if they put everybody on hydroxychloroquine, schools will open back up. If they put the vulnerable on
like
hydroxychloroquine,
preventatively, you don't even have to be diagnosed.
You don't even have to be diagnosed. Preventatively.
Well, I mean, you're going to run afoul of your medical license if you start doing that, aren't you?
My medical license?
Yeah.
So you think that I should defend my medical license over people dying? Over people dying?
Aren't you worried about losing it?
Losing what?
Your
medical
TMB license, yeah.
Really, let TMB come after me. I should let people die because I'm scared of TMB. Or I should let people die because I'm scared of Anthony Fauci. I should let people die because I'm scared of WHO. I'm not scared of any of them. I'm not going to let people die. And if they come after me, it's going to be on. I'm not going to let people die. If they can take my license, if they do it, then I don't even have a license to defend. And it's going to be on. If they come after my license that I did something wrong, that will be different. If they come after my license because I saved people, because every patient that I have seen has lived, there are doctors out there that are talking smack. And I'll tell these doctors, go see your patients. I had a young man, a man drive almost 2-3 hours to get here because he went to the ER, he had COVID, he had he had pneumonia in the chest, and they refused to give him hydroxychloroquine. He asked for it, they refused. My question is that everybody has a right to try. If I want to try a dangerous drug, let me try it.
You think?
And of course, there's a right to try in America. It's a law. That is why.
Wait, I can't walk into a doctor's office and say I want to try this drug?
No, there is actually a right to try. Do you know why there's a right to try experimental drugs? It's the law of America. You can actually try experimental drugs. But hydroxychloroquine.
No, the FDA has barred this, though.
No, the FDA did not bar hydroxychloroquine. That's a lie.
No. The off-label usage for this.
They did not buy it. When did they do that?
Shortly before those 2 studies were retracted.
That's not true. That's not what FDA said.
What did they say?
FDA said they have withdrawn the emergency use for using that medication in the hospital because it was not effective. I don't think you should wait to use hydroxychloroquine when somebody is admitted in the hospital in a cytokinin storm. You should use hydroxychloroquine early. If the FDA had barred doctors from using this medication, nobody would be able to prescribe it. The FDA did not do that. And the FDA cannot do that for a medication that is used off-label. If they do that, then they have to have a whole new law about off-label. Do you understand what I'm saying? The FDA cannot do that. They did not do that. The FDA said we're taking off the emergency use, this thing. When they take off the emergency use, then they release the stockpile into the nation. So the FDA did not do that. That's number one. Even Texas Pharmacy Board initially had put some restrictions on how much you should give. That restriction has expired on, I think, on the 17th or so. They did not renew the restrictions. So there are actually no legal restrictions for a doctor prescribing this medication, except in Ohio, that the governor, who is not a doctor, has barred it. There is none. There are pharmacies right now that are taking upon
themselves. Well, Dr.
Urso
is dealing with a complaint that was made against him to the Texas Medical Board.
Yep. Many doctors they've made complaints against a lot of people.
You've had a complaint against you, haven't you?
I don't know about it yet. If they make a
But you're not worried about it.
No, I'm not. What would I have done wrong that I'll be worried about a complaint?
I get you.
Do you understand? So I'm supposed to have kind of like committed some crime that you're worried about a complaint, right? Taking care of patients. So this is the thing with Texas Medical Board. Any complaint that they make about any physician about anything has to be investigated. They have an obligation to do that. So I'm not knocking Texas Board about that. I don't think Texas Board has come and arrested any physician or taken their license because of that. If somebody lodges a complaint, they're going to investigate it. Yeah, so that is what they have to do. They cannot say we're not going to do it because, they have to do it.
So do you feel like, let me ask you this, let's move along. So I really do understand your points, but do you feel like you've been vilified since you were in Washington? I mean, people have brought up these videos, these sermons. They've made you out that. I mean, how do you look at it?
I would really like to. I know a lot of people are kind of like, well, Dr. Stella, for you. I don't have one. Let me put it this way. I don't even have one bone in my body that feels vilified. Really. I'm one of those. I'm like a totally like thick-skinned, number one. Number two, I'm like I don't have one of. I'm not sensitive about stuff. I don't have a sensitive bone in my body, so I really don't care.
When people bring up your religious beliefs, does that bother you?
Bother me? You kidding me? Let me tell you something. I had this video I did about incubus, succubus spirit, which are like demonic spirits that sleep with people at night. This video...
To some people, that's a far-out concept.
Yeah, sure.